I'm a psychiatric nurse. Early in my career, I worked at a residential mental health facility. There was a resident I'll call Marion Duchesne. He was an elective mute, which simply means that he didn't or wouldn't or couldn't talk, but there were no pathological findings as to why. He had spoken earlier in his life and in fact seemed quite normal back then, with the notable exception of being close to 7 feet tall. He'd been raised in the Deep South and joined the military when he was 19. After boot camp, he was stationed somewhere in the South. One night, he just vanished. It was declared an AWOL for years, and finally he was declared missing and dead. 10 years later, a 7-foot-tall man walked into a VA hospital emergency room in my part of the Midwest and said to the receptionist, "My name is Marion Duchesne and I've been dead for 10 years. Those were the last words he ever spoke. He was covered with dust and he was wearing the same clothes he'd been reported to be wearing the night he vanished. His social security number had not been used and he had no identification on his person. However, they were able to identify him, I guess via fingerprints. He was well-fed and in good health, except for his refusal to speak. The family was notified, but they said they had already grieved their lost man and that whomever was claiming to be him simply could not be. They said he was a haint and a stand-in for their dead relative and demanded not to be contacted again. Marion paced all day every day. Not in a frantic way, but just lumbering up and down the halls and outside. He smiled all the time and would be moving his mouth in a way that indicated talking or muttering, but he was dead silent. He had an unnerving habit of throwing his head back with his mouth wide open as if he were laughing heartily, but not even a breath could be heard. If told to go to the dining room for a meal, he'd go and eat. But if nobody told him, he just kept pacing, never indicating hunger. If offered a cigarette, he'd smoke it in an oddly formal way, almost delicately, if that makes sense. But he never seemed to crave smoking. The man wanted nothing. If I talked to him, he appeared to listen, periodically throwing his head back in that laughter-mimicking way of his. There was nothing to do for this man. Various medications were tried, but they did not affect him either positively or negatively. Occupational therapy did nothing because Marion would just grin, and unless told to stay put, he'd get up and start pacing again. On my last day at that job, on my way to something better, the last thing I saw was Marion pacing in the parking lot, throwing his head back to laugh. Later, I wondered if all along I'd been dealing with a ghost. All these years later, I still don't know. There is probably some medical explanation for this, but still the weirdest thing I've seen as a nurse so far. We had a very robust, confused old lady on our floor. Her room was in front of the nurse's station, so we could keep an eye on her and had one of our nurse's aides as a sitter too. She was always fighting, kicking, trying to get out of bed. Very restless and agitated, as some patients I've had before can get before death. One day we were called into the room as her heart rate was going down and she lay still with her eyes open. It was 30, 20, then flat-lined. We checked for a pulse and did not find any. She was a DNR, so we did not attempt resuscitation. We closed her eyes, prepare to get the body bag and call the family. The sitter remains in there to start getting the body ready. Less than 10 minutes later, she calls us back in. The old lady is at it again, hitting, kicking, trying to get out of the bed. She came back to life. Honestly, we found this situation hilarious, and I still have never seen any patient come back like that on their own. I think she made it out of the hospital too. I'm an ICU nurse. A patient's son rang the hospital at 11 p.m. on a Saturday night saying he was sure his dad was dying. His dad had had a severe stroke and was doing okay. Recovery would be difficult, but he wasn't expected to die and was pretty stable at the time. I was looking after him, and he was a lot of work because he would try to get up but couldn't walk, so he'd fallen a lot. The son really wanted to come in, even though it's way past visiting hours, but I'll bend the rules in a good cause. I figured, what the heck, it's his Saturday night, come on in and sit with your dad. Patient died about 2 minutes before the son walked in the door. It was like a switch was turned off. He just died. The last thing he said to me was, "Am I bothering anyone?" I told him of course not, even though he had some very frustrating behavior because of the stroke. The son just started crying and screaming. I knew it. How the heck he knew? We were all a bit freaked out. I worked in a pediatric hospital and had always heard that the 4th floor right outside our oncology unit was haunted. I worked 3/12s normally, but would pick up overtime and picked up a night shift. I was working in the NICU, which happened to also be on the 4th floor, but on the opposite side. The oncology unit had a staircase that was a shortcut down to the cafeteria, which was on the 2nd floor. At about 3 a.m. I was ready to take a short break and wanted a cup of coffee from the cafeteria, so I decided to take that staircase. I walked through the automatic double doors and saw a kid skipping down the hall. I called out to him as I was afraid a little kid had snuck out of a patient room. As soon as I called out to him, he turned, and in the blink of an eye totally vanished. A lot of other nurses and docs had seen the same little kid skipping in that same hallway. Of course, I chalked it up to just exhaustion and didn't really think about it much after that. But you were damn sure I didn't use that hallway at night ever again. I worked in geriatrics, nursing homes, for years, so most of our patients died within a few years of being with us. Anyways, I had a new patient move into one of the rooms on my hall that my previous patient had just passed in. My new patient kept calling at night saying that there was this woman who kept coming into her room and trying to talk to her. At first I just passed it off on her being in her 90s and struggling with dementia, so I assured her that I would lock her door at night to make sure no one could come in. After about a week of this continuing to happen, I sat down with her and was asking what this woman looked like, thinking she may just be hallucinating her daughter or sister or something, and she proceeded to tell me that this woman had a pink robe on with blue fuzzy slippers and her hair up in curlers, and the women would come and sit at the foot of her bed, pat the new patient's feet and try to talk to her, but she couldn't understand what she was saying. I almost pissed myself. The patient that I had had in that room prior to my new one went to bed every night in her pink house robe, blue slippers, and her hair in curlers. It stopped after about 2 weeks.